In this episode, I'm going to talk about how you can use your own healing power within your blood to treat ED, and know that there is alternative to ED besides surgery. So stay tuned this episode and I'll dive into it. This podcast is for you, the modern man. I'm Dr. Truong, your host. I'm an intimate health medical doctor and best-selling author of the book Erectile Dysfunction Fix. I'll do a deep dive into sexual health and performance and how it affects men of all ages and backgrounds. So let's get started, and be sure to visit my website at sexualhealthformenpodcast.com for more information and resources from the show. See you on the inside. I'm going to dive deep and talk about how you can harness the healing power of your blood to treat erectile dysfunction. Let's start out with what I am talking about, first of all. Your blood? Well, you have about 5 liters of blood in your body. And I want to show you that if you can harness the blood that you have in your body, which is 45% red blood cells and 55% plasma. Plasma only has like proteins in it, is yellowish in color, and then 1% of it is the white blood cell and the platelets. As you can see in the picture here, your red blood cells are the one that carry oxygen from your lungs all over your body to feed every cell in your body with oxygen. And then the platelets are these little small cells, and you can see they're purplish in color on the slide that I have. And they, along with the white blood cells, comprise about only 1% of your blood. But the platelets is what I'm going to concentrate on, okay? Because the platelet is involved in a lot of factors. They're small, but yet so powerful. They are vasoconstrictors, which mean that they help make the blood vessels smaller to reduce blood loss. They stick together to form a platelet plug, which then seal the small breaks in the blood vessels. And they secrete something called procoagulant or clotting factors, which promote blood clotting. They also initiate blood dissolving enzyme, which dissolve blood clots as well. And they also secrete a chemical that attract white blood cells such as neutrophils and monocytes to the area of inflammation. So they induce inflammation, which then induces healing. They also destroy bacteria, so it helps with immunity as well. But most importantly, they secrete growth factors in the cell, and they secrete it, which then help with new cell formation such as fibroblasts, or help maintain and repair blood vessels. Now, why is that so important? Let's kind of tie that to erectile dysfunction. Erectile dysfunction is mainly due to poor blood flow, right? And what is poor blood flow? That means that the blood vessels that are flowing from the groin to your penis is impaired. And if you listen to my previous podcast episode, you know that the blood vessels aligning the endothelium is impaired, and therefore it causes little leakage outside the blood vessels, which then, when blood flows in, the leakage or holes in the blood vessels leak out blood, and therefore you lose your firmness. Therefore, that's why you can't get a firm erection. Well, platelets can actually repair that leakage by developing a clot in that area and stimulate other cells to come by the area to repair the blood vessels and repair smooth muscle. The penis is a smooth muscle, and the penis needs blood vessels to create an erection. You can't have an erection unless you have good blood vessels and good blood flow. And platelet does that job. So let's dive in a little bit more. So platelets are these little, small, little cells in your blood. And then when you have a little tear in the blood vessel, the platelet goes in there and create a platelet plug, which then covers the broken blood vessels. And then over time, it creates a fibrin clot, which then starts healing that blood vessel. And that's exactly what you need to repair blood vessels so that way you can get more blood flow for an erection. So stay with me here. So how do we get platelets from your blood? Well, you get the platelets from your blood by just as if you get a blood draw. You go to the lab and you draw your blood. And normally in the lab, if you get like a typical cholesterol or blood sugar test, they take about maybe like 1 or 2 tubes, maybe 3 tubes, and each tube is about 2 cc, so maybe 1 tablespoon of blood. However, when you're trying to harvest out platelets from your body that is used for healing, normally most places draw maybe about 11 cc to 22 cc, maximum maybe 30 cc. 1 ounce is 30 milliliter or cc of blood. Most places draw about 30 or 11 cc's. In my office, I draw about 120 milliliter or cc to 180 milliliter. And that depends upon the age as well as whether the man is undergoing testosterone replacement therapy. Because when you're undergoing testosterone replacement therapy, you tend to develop more red blood cells. And therefore, with red blood cells, they're more in the blood. So we need to draw more blood to get more platelets. Now, 120 cc is an equivalent of 3/4 glass of wine. 180 cc is a little bit fuller than a glass of wine. Glass of wine is about 150 cc of blood. Remember, 1 ounce is 30 cc. So I draw a lot because I'll go into it the next slide. It's because we need that much blood to get a therapeutic effect from the platelets, which you need more than 10 billion platelets for healing. And if clinic that you go through that draws your blood, that is about less than 60 milliliter or cc of blood, it's not going to be enough. And depends on what kit or machine they use that is able to extract out the platelets from the blood as well too. I use the M-Site Pure 60 cc kit, which has an extraction of 97%. So I'm able to deliver 10 billion platelets into the tissue area. So for a therapeutic healing effect of the blood vessels and the smooth muscle. So the platelets are harvested from your blood, which is then put in a tube in a centrifuge, and the centrifuge spins it and it falls according to the weight of the cells. So you can see the picture on here. When it comes out from the centrifuge, the yellow layer is called the plasma layer because it's the lightest layer of all. The middle layer is where the platelets are at. They're right at the junction between the yellow and the red blood cells. And the red blood cells are the heaviest, so therefore they fall down on the bottom. But right next to the platelets, you can see in the picture, you can see the white blood cells, which are the monocytes, the lymphocytes, and the neutrophils. And platelets have multiple functions that you can see from the picture. It helps with collagen production. It helps with regeneration, repair of blood vessels, like I talked about before. It helps with wound healing. It also helps with repair of the endothelial cells. Endothelial cells are the cells that are lining the inside of the blood vessels. And it also generate fibrin as well, a keratinocyte. And so platelets can play a role in regrowth of the hair. It can play a role in stimulating collagen, so it helps with wound repair. It can also be used in dentistry. It also can be used in joint pain, such as arthritis, or particularly it's commonly used for like a rotator cuff tear, for like a tendon tear or ligament tear. because it works well in soft tissue such as tendons and ligaments. It works well in actually osteoarthritis as well, but you can put it on the face to help with the wrinkles. You put it in the hair for hair regrowth. In fact, you can even put it in the breast tissue for more fuller breasts. And definitely you can put it in the genital area for soft tissue and wound healing and stimulation of blood vessels as well. So then the platelets are then harvested from the tube and is injected into the targeted area. So that could be, as in the case of erectile dysfunction, it's injected into your penis to repair the blood vessel that is leaking and also increase blood flow to the area, but also repair the smooth muscle of the penis as well. Now, how long does it take for this repair? It starts about 3 weeks and it's maximized and peak out at 3 months, when the effect can last up to years, at least a minimum of 1 year. And it depends on how severe your condition is. If you have severe ED, you may need more than just one platelet-rich plasma injection. If you have mild, you may just need one as well. So you can see on the slide that I have here that at least 10 billion platelets must be delivered in about an 8 cc aliquot for a positive outcome. 10 billion. Now, compared to other clinics that may not use as much blood, or the MSite kit that I mentioned, they get suboptimal amount, like the Regen Lab, which there's a study that compared the Regen Lab to the MSite Pure 60. And the Regen Lab only draws about 11 cc kit, and it therefore can get about 0.5 billion platelets, which is suboptimal. So if you're getting an injection of less than 60 cc of blood, you're getting suboptimal injection and you're getting suboptimal result, and therefore you're not going to have a therapeutic or improvement in your ED at all. So always ask the clinic where you're going to, how much blood are they drawing out? They need to be drawing out at least 60 cc. They need to have a kit that is able to extract out about 95 to 97% of the platelets, and they need to be able to deliver at least 7 to 10 cc of PRP or platelet-rich plasma to be injected. At our clinic, again, we draw out 120 cc to 180 cc of your whole blood. We end up with at least 13 billion to even 20 billion platelets that is injected, because we want to make sure that you're getting a good therapeutic dose, so that way that we want to knock your ED out of the ballpark, so that way you can get results. Now, let me add on there too that we also combine Botox with the platelet-rich plasma, because the Botox relaxes the muscle. So if the Botox relaxes the muscle quickly, and the PRP can repair the blood vessel to increase blood flow, wham, you get quick result, accelerated improvement, because you can see result within about 5 days. And the additional benefits of adding Botox to the PRP is that you get about 1 centimeter more in length and in girth. So that combination is gonna be exciting to do, and I've been doing it to my patient. We've been seeing excellent result. Now, it's not for everybody at all, because I want to mention that you have to see the doctor to make sure that you are a candidate for this. Now, this slide that you see here shows billions of platelets that can be harvested from the blood. And you can see from the MSite is at least 6 billion from a 30 cc blood draw, which is the highest of all. And other kits such as Regen Lab, Cellfill, Eclipse get about 1 to about 3 billion, which is suboptimal, because you need at least 10. Now, this is with 30 cc of blood. All right. Now, I get 120 cc of blood at the least. So times that by 4. So 4 times 6 billion is 24 billion. So I'm giving you at least 24 billions of platelets per injection compared to other kids, which is suboptimal. You need at least 10 billion. So keep that in mind and ask the clinic where you're going to how many whole blood are they drawing out and how many platelets are they delivering per injection. And let's review why platelet-rich plasma is important and can be used as a treatment option for ED, because the platelets can repair blood vessels and can also repair soft tissue, collagen as well. And therefore, if you can repair blood vessel, if you can repair the endothelium lining of the blood vessels, you increase more blood flow. And ED is due to decreased poor blood flow as well. It can also help with repairing of the muscles as well. But I mentioned that you can combine that with Botox. Now, the slide you see here, that you can see that I'm comparing the effect of Viagra to PRP. And the PRP injected into the penile tissue or the corpus cavernosum, that it treats the cause of the problem due to poor blood flow or leaky veins of the penis, where sildenafil or Viagra treat the symptoms, right? It treats the symptoms, and it's like a pain medicine. You take it and your pain get better, but it doesn't treat the cause of the problem, unlike PRP. And now PRP is natural. There's no side effect. It's your own blood. And versus sildenafil, we know that there's a lot of side effects. The medications such as headache, facial flushing, stuffy nose, indigestion, and the blue tint vision. With PRP, the result is you can get spontaneity, you can get more firmness, you can get more stiffness, and the result is natural. You don't have to take a pill every time you're getting ready to go. You don't have to time it to anytime you need to perform at all. And there's no medication needed. And you actually have increased sensation in your penis, and there's 85% satisfaction. Now compare that to sildenafil. There's no spontaneity. In fact, the absorption of the medication depends on what you eat before, and you got to time it between 45 minutes to an hour. And I have known of cases where you take the pill and when you're ready to go, your partner falls asleep and you're just left like, okay, what am I going to do and go from here? And then if you have heart condition or even prostate problem, and if you take a nitrate, you cannot take sildenafil at all. And that after a while, the medication wears off and you're not going to respond to it as much. That's because the cause of the problem why you had ED, which is poor blood flow, gets worse over time. In fact, I know, not my patient, a friend of my patient who took Viagra, didn't see much result. He took another dose, and then because he double dosed on Viagra and he also took other supplements with it, he ended up having a heart attack in the bedroom and unfortunately passed away because he took too much Viagra. Because Viagra can also, or sildenafil, can also increase your blood pressure and therefore can cause stroke or heart attack if you take too much. And the satisfaction of sildenafil is around 70% when you first try it versus satisfaction of 85% with the PRP. And not to mention, on my previous episode, I talked many times that sildenafil can steal away your natural response to getting an erection. All right. An erection starts in the brain. The brain is the largest sexual organ. All right. And everything starts in the brain. You have to be aroused. You have to be turned on. And sildenafil will not do that for you. And all sildenafil does is go to the penis and relaxes the penis muscle by increasing nitrous oxide. But it takes away the brain. It takes away the involvement of the heart rate. It takes the involvement of the hormones that's being released in your brain, and you're really bypassing the natural response of your body to have an erection. And if you take sildenafil for a while, you might as well just give up your erection to the pill, and as well as your confidence as well too, because you're always going to think that you need that pill to have an erection. And over time, it's not going to work. Over time, you're not going to have as good of an erection because you're really ignoring the problem as to why you have ED, and it gets worse over time. And what I see is about the duration between 2 to 5 years. the sildenafil stopped working and you wonder, where do you go from here? Penile implant or no sex life? And then not to even mention that the reason why you have decreased blood flow, the condition getting worse could even affect your heart. And the 5 major things, let's review the 5 major things that can contribute to ED or contribute to low blood flow is smoking, all right, high blood pressure, high cholesterol, obesity, diet, a poor diet full of carbohydrates, sweets, bread, pasta, processed food, and inactivity and overweight, as well as stress and not enough sleep. Those are just the main things that you can actually modify, actually, and will go a long way to treating your erection. So those that are listening to this, just know that there are alternatives to treatment of ED, which you can use your own blood to help heal the poor blood flow that is causing your ED, and the flow can be reversed, so that way you can have more blood flow to treat the ED. So keep that in mind. Those that are listening, write this down. Platelet-rich plasma, or the blood that is, or the platelet that's in your blood, can help heal your ED. Now, healing the blood flow, but you have to continue, of course, with diet and exercise and all the lifestyle modification that I mentioned earlier. And I love to hear from you or see what your thoughts are about this, and know that there are other alternatives to treatment of ED. And before you get that penile implant, to make sure that you explore this option. And to review, if you are getting platelet-rich plasma, make sure that you're getting at least 10 billion platelets. And if you're getting anything less than 10 billion platelets, you're getting suboptimal results. Suboptimal result mean no improvement, and you're just wasting your money and your time. So having said that, thank you for being with me today on this episode. I will see you next time, and make sure that you look at the show note and to check out a free gift that I'm giving you in the ebook on 5 common mistakes that men make when facing ED. And I would love for you to check out the Modern Man membership. It's the place where I coach men with ED. It is the community support of men with ED as well too. And just know that you can have treatment and live an ED-free life. I'll see you in the next episode. Thanks for listening to the Sexual Health for Men podcast. If you love this episode, then please take a screenshot on your phone and post it on Facebook, Instagram, or wherever you post. And be sure to tag me and let me know why you like this episode and what you like to hear in the future. That will help me know what's great for you, and I would love to give you the most incredible free gift designed to help you improve performance quickly. Go to my website at sexualhealthformenpodcast.com to get the book, The 5 Common Costly Mistakes Men Make When Facing ED. I would appreciate it if you subscribe, leave a review on Apple Podcasts or wherever you listen, and just know that you can have sexual vitality for life. I appreciate you. Until next time.